Just wanted to walk through the label for this drug, looking at it just from a clinician perspective. So a lot of times when I'm going through, I'm just looking for anything that might be out of the ordinary in terms of why a drug might have to be prescribed a certain way, or what was the FDA thinking about in terms of the language that they're using. And really, I think that the first thing I wanted to highlight was just looking at some of the adverse reactions. Now, when I'm speaking to patients just about generally anything and I'm about to do from them from a procedural standpoint or from a prescribing standpoint, we usually like to highlight just some of the most significant side effects of drugs just so they're aware and understand that it's something that potentially could happen. And a lot of times when you do this, especially given options, if a patient has multiple options, if there is something that may seem like a significant side effect, there's a lot of hesitation. And so I can imagine that there may be some difficulty in explaining that this contraceptive choice could have, vaginal burning sensation or vaginal itching, as well as an increase in rate of urinary tract infections, could potentially turn some patients off to this. Now, it is something just to note that it only occurred in about 1.6 of patients in terms of them discontinuing use of the drug because of these symptoms. Now, I don't know the exact setup of this trial. I don't know exactly, what participants received for staying in the trial. But generally speaking, most people do like to stay enrolled in trials. There is some monetary benefit to doing so. And in terms of how things are done actually in the real world, it'll be interesting to see how things bear out, just in terms of if people are able to appropriately use this product, which seems actually fairly easy to use when you go through and look at the label, but also just in terms of if someone would discontinue this product. It's also important to note as well that men also had some adverse reactions to this, and it's something that women should be discussing with their partner as well, just so they're aware of this. Many of this was mild. Only 2 subjects discontinued because of the male partner's discomfort. As I scroll down, you see some of the chemical structures of the drug, and while I do think it is a simple, smart solution lowering the pH, I think it's also important to realize that a woman's vaginal pH is at a certain level because of what ultimately at baseline is normal for their own homeostasis. And so changing that can have some unforeseen consequences, potentially just in terms of, like we saw earlier, with infection, some burning, and itching. Now, it is important to note that the pregnancy rate still was 13.7%, and this is just looking at in terms of over the course of 7 cycles. This isn't looking at a total year of being on this drug. And so typically when I'm looking at how well contraception works, I'm looking at it in terms of a total of 12 months and not 7 months use. So this rate was 13%. Obviously, it does work to reduce the rate of becoming pregnant as what would be if there was nothing used. But if I'm looking at other things, that some of which can be used in conjunction to this drug, over the course of a year, looking between typical and perfect use, and that's important to highlight as well because, in a clinical trial, you're getting more towards perfect use rather than typical use, which is how it's used out in the world. And with it, there are any mistakes or anything being done, this is the typical use percentage. And so there's still a significant number of things that have higher efficacy over the course of a year and not only 7 months. And so the longer you're going, the less efficacious you ultimately will be in terms of chances for you to ultimately become pregnant. I think the other just small thing that I noted in terms of the language is that if you are having sex more than one time within an hour, you must use a new pre-filled applicator. Now, again, this is important because it comes back to what the cost of this is. And from what I've seen, each box, if you're paying without insurance, is $275. I'm sure with insurance and a copay, it's not very expensive. But for those who don't have insurance, this would be pretty prohibitive relative to condoms and other uses of contraception. The rest of this label is just going through how to use the device and some storing information. So really that's all I wanted to highlight with this, but I think it's important to go through the label and just to see if there's anything in particular that jumps out that might limit its use of a drug or limit potentially it going out to ultimately generate revenue for the company.